Hi, I'm Warren Hammert. I'm a hand surgeon in the Department of Orthopedics at Duke Health. I like to take care of patients that have conditions really from the elbow down to the fingertips, the forearm, the wrist, and the hand. I treat patients of younger age all the way up to more experienced people in life, so I have no age limits on patients that I see. I see everything from traumatic injuries to reconstructive conditions, things like carpal tunnel and nerve compressions that cause numbness in the hand, tendinitis, arthritis, fractures, dislocations, and other sorts of injuries, as well as nerve injuries and patients that have congenital or birth differences as well. So when I first meet the patient, I like to really get an idea of who the patient is and really what the patient is about, because there's different patients that have the same problem and the approach may be completely different. So I always said it's more important to know the patient and then know the condition they have rather than just know the condition they have, because I like to tailor that to the individual needs of a particular patient. But one of the things that I always like to say is, people sometimes take for granted that their hands work and they don't think about it until there's a problem. And then they come in and see me and they'll say something like, Doc, I got to use my hands. I use them every day. And I understand that as a hand surgeon because all my patients that have hands use them every day. But it's something that often you take for granted or you don't think about until there's a problem. And the ability to restore you and give you the ability to use those again in the way that you need to can be very gratifying. I'm an avid sports fan, particularly college sports, but I like almost all sports. I like to be outside, very avid bicycle rider, so I love riding my bike, and certainly the weather here and the places to ride here has been quite remarkable. And spend time with my family.